When is the last time you had a cigarette? When is the last time you had a cigarette that you weren't smoking, but that someone else was? Don't you think it's time that we clear the air? Stay tuned for Health Watch. Hi, I'm Terrence Affer Anderson, and welcome to Health Watch. The Tobacco Use Control Project of the Virginia Department of Health Division of Chronic Diseases and Prevention and Control reports that smoking in Virginia causes some 9,200 deaths each year. Further, it is estimated that some 152,000 Virginia children under the age of 18 would die prematurely from smoking. More than 85,000 Virginia high school students smoke, and each year more than 9,400 teens become daily new smokers. But it is not just the personal health of smokers and those around them, secondhand smokers, that is of grave concern. Smoking also has a devastating impact on the Virginia economy. The Campaign for Tobacco-Free Kids reports that the medical care costs for smokers and former smokers in Virginia is estimated at a staggering $2.08 billion. The Centers for Disease Control and Prevention reports that nationally, the medical care costs for smokers and former smokers is an astounding $96 billion each year. So, you see, smoking has a devastating impact on the health of the nation's economy, as well as the personal health of smokers and former smokers, and yes, those who suffer the consequences of secondhand smoke. But there are, of course, dramatic benefits to be derived from tobacco and smoking cessation, and today we're going to have some pretty insightful, encouraging discussion on that topic. Join me now, please, in welcoming my guest for today's show, Chelsea Jones, the Eastern Health Educator for the Tobacco Use Control Project of the Virginia Department of Health Division of Prevention and Health Promotion. I'm also welcoming an old friend whom I've known for more than 30 years now, but who stopped smoking so long ago I had forgotten that he even smoked. A hearty, healthy welcome to Joe Austin. Welcome to Health Watch, guys.
Thank you.
Thank you for having us.
Joe, as we prepared for this show, you shared with me that you used to smoke 2 packs a day, and that's been so long ago, I don't even remember. How did you get started? How long did you smoke?
We were living in Poplar Halls, and a young gentleman whose name I'll keep anonymous. We were walking down the median down Poplar Halls Drive, and he had a pack of Viceroys.
Viceroy?
Viceroy, yes, sir.
Okay.
Pulled the Viceroy out and lit it up and smoked and said, "Come on, Joe." I got curious as a child. I said, "Okay." Smoked a cigarette and I coughed till I was in Costa Rica, it felt like. But that's when it started. And I stopped, I smoked until 1989.
Until 1989. So we were talking earlier, you smoked basically from 65 to 89. That's
60,
some
yes,
24 years.
67 to, yes, something like that.
Was that the primary reason that you started at a tender age, just because of the curiosity, or you were encouraged to do so?
Just because of it. And in our home, there was no smoking. My grandparents didn't smoke, my uncles didn't smoke, so I was curious to what other folks, quote unquote, were doing. And I got hooked, and it was a terrible decision, which has ramifications as we speak, because as you get older, your body kind of slides down. It doesn't stay the same, so it didn't help.
Now, you didn't start out, obviously, smoking 2 packs a day. Do you remember when you increased up to that level and why you did so?
I remember it after high school. I remember it in the early 80s. Latter 70s. Got out of high school, thought I was grown. I knew everything, et cetera, et cetera. I had a Gulliver's Travels mentality. And I started smoking and smoking and smoking. Then it got to be a habit. I was addicted. So 3 cigarettes turned to 10 cigarettes, it turned to 2 packs.
Wow. It just consistently escalated.
It was a domino effect, and it didn't help.
How did it impact your life personally?
Economically, it did.
Economically back then, even.
Yeah. I mean, they were like $1.50, but still it was $1.50. In those days, you didn't waste $3 on a pack of cigarettes. Either was a bike or some ice cream sandwiches or McDonald's or something like that. And then the price was paid by my parents. 'Cause when they smelled those cigarettes, I got hit. It was corporal punishment. Yes.
Okay.
They didn't do a lot of talking.
So you paid the price on a couple of
that spurred me into quitting.
Chelsea, there have been a number of people, of course, fortunately like Joe, who were serious smokers for a long period of time but eventually stopped. But there is some kind of increase that's going on. What do you think is happening right now?
As Joe said, he started smoking under peer pressure as a kid, which a lot of youth tend to do. People are also influenced by their family. He said his family wasn't smoking in their house, but families that do smoke, the kids tend to smoke and then they have a harder time quitting later in life, or either they don't quit later in life if they come from a smoking family. Other things that could impact is your economic status. The less money that you make, the more likely you are to smoke. And
Is
also,
that because of stress, or what is? Do you think it's because of stress, or?
probably.
Yeah. Okay.
Probably. Other reasons is less education. The less education you have, the statistics show that the more likely you are to smoke.
I remember. I'm old enough to remember. I'm old enough to remember dirt. Some people would say when it was first invented, but. I remember the old television commercials for cigarettes, the Marlboro Man and the Winston Man, and I remember the advertisements at bus stops and on the radio and so forth. Are there cultural influences today, you think, that influence people to smoke?
The media definitely does. There just was an article in the paper September 21st, just a few days ago. The Federal Trade Commission said that media spending for the tobacco industry had gone down, but it's at $8 billion.
$8 billion.
$8 billion, and I broke that down. That's $23 million per day, or $1 million per hour they're spending on advertising to get kids and youth to start smoking.
That's incredible.
It is.
I remember not too long ago they stopped using the what was a camel, that
Yes.
cartoon camel. That,
The cartoon camel.
yeah. So let's take a closer look at some of the statistics that I mentioned earlier. You know, of course, most often when you give statistics, the people's eyes tend to gloss over. But I think these kind of statistics will wake people up. I certainly hope they wake up folks that do in fact still smoke. So let's take a look at some more of those statistics.
I can tell you about adult tobacco smoking in Virginia. In 2009, 44% of Virginia adults reported having tried a cigarette, and they smoked at least 100 cigarettes in their lifetime. That equals some 2.6 million adults in Virginia. Men are more likely to try smoking than women, 51% versus 36% women. 1.14 million Virginians, which is about 19%, are current smokers. And 73% of the current smokers are daily smokers, so that means they smoke every day. Virginia has the 18th highest adult smoking rate in the nation. And while the current smoking rate has been declining over some time, the adult smoking rate suggests a reverse trend, probably because of the economy.
Because of the economy. So stress does really appear to be a real indicator of someone that might smoke. What Virginians, can you give us a demographic profile of Virginians that are at the greatest risk for smoking?
Males have the greatest smoking. The young, which is considered 18 to 24 years of age. Low income, which means they make less than $35,000 a year. High school dropouts, or those with a high school graduate degree only. People that are unemployed or unable to work are more likely to smoke. Those that don't have medical insurance. Those who have a physical, mental, or emotional disability tend to smoke more. Those that are mentally stressed or binge drinkers smoke more. Those that are physically inactive or have some type of chronic disease like asthma.
Now, as we were talking to Joe, Joe spoke about the lack of an influence in his environment that caused him to smoke. But, you know, his peers and in the African American community. What can you tell us about African Americans and smoking?
There's estimated 45,000 African Americans that die each year from smoking-related disease. Most of the illnesses that they die from are lung cancer, cardiovascular disease, and it's the leading causes of death in the African American community. Estimated 1.6 million black Americans under the age of 18 who are alive today will become regular smokers. This includes 500,000 who will die eventually from their smoking.
That's incredible.
In 2011, 23,000 new cases of lung cancer and 16,000 deaths from lung cancer were expected to occur among African Americans. And the lung cancer death rate among African Americans was 23% higher compared to white men.
That's significant.
Non-Hispanic blacks die from heart disease, cerebrovascular disease, and lung and bronchus cancer at greater rates than non-Hispanic whites. And there are estimated 160 black adult smokers in Virginia.
160,000.
Oh, 160,000, sorry.
Yeah.
More than 75% of African American smokers smoke menthol cigarettes. And menthol cigarettes are associated with higher carbon monoxide levels in the bloodstream that may increase absorption of nicotine, resulting in a greater addiction. The menthol sort of numbs the throat, so it allows you to inhale just a little bit more.
I was curious
wondering
about
why
that.
they were questioning the menthol.
Yeah, I was curious about that because frequently there's a stereotypical portrait of African Americans smoking menthol cigarettes, and I was curious as to why that was indeed the case. But
it numbs the back of the throat, and
I
as
see.
you inhale, it allows you to inhale deeper.
Joe, what about your experience as a young smoker? I want to ask you about your experience as an adult smoker when you stopped smoking as well. But as a young smoker, now you smoked Viceroy. They were not menthol,
No,
right?
I started with the so-called big boys, with Viceroy, Marlboro, Camels, and then I progressed into the menthol that she just spoke about. It was a chic thing at the time for me because you saw guys on TV, Shaft, all that stuff, smoking cigarettes. So you got a menthol. So it influenced you, like the cigarettes influence these kids now in these videos. You see the smoke going around in cigars and what is it, Black and Miles, that stuff. And it's a gateway to smoking a cigarette, or vice versa.
You saw a lot of African Americans though smoking cigarettes.
In those
back
movies
then.
in those days, yes. You know, and when Church Street in our town was vibrant. When you go on Church Street, you go by Mark IV, you go by Regals, you go by Queens, and the people that you want to be like were smoking cigarettes.
Right.
So you saw that.
Beyond smoking, I really missed the old Church Street. Such a colorful.
That's why I brought it up.
Yeah. Now we're going to take a bit of a break right now, and when we come back, I want to talk a bit more about what you have experienced in the African American community since you stopped smoking. Okay? Okay. All right, so we're going to take a short break right now. When we get back, we're going to continue this important discussion and conversation about smoking cessation. Stick around, please.
The bud stops here. Keep Norfolk beautiful, y'all.
So, Joe, when you were smoking 2 packs a day, I want to talk about what has been your experience in the African American community since you stopped. But when you progressed from smoking in the beginning 3 to 6 a day up to 2 packs a day, when you were smoking 2 packs a day, did you see a lot of African Americans smoking still?
Yes, it was. At the time I was at work or at a football game or something, you know, you go outside and take a smoke after you eat, or some coffee. But yes, in the community, yes, you know, we were trying to be grown, quote unquote. So as we got older, we would smoke after high school football games, after dances, etc. The old giant open air parking lot was the mecca for us back in the day. We would go out and get some pizza and some barbecue chicken.
Which one are you talking about?
The one on Campbell Road.
Yeah, okay.
That was the mecca. So we would go there every Friday night after the game, and everybody would just come up and you just start smoking. Or you didn't smoke, you would be around people who smoked, secondhand smoke. So as I progressed from 2 or 3, it was chic, it was vogue, it was, you know, and then I got hooked.
Now, what about today? Do you see many African Americans?
Yes.
Still today?
Unfortunately, yes. Some seniors I see are still smoking.
Folks that you knew when you were smoking?
Yes. Yeah. And some acquaintances are still smoking. 80-something years old, still smoking. And it breaks my heart to see it because, you know, these folks have lived this long, and I want to see them enjoy this part of their life in their golden years, and see them smoking. It breaks my heart, and it humbles me to know that I quit at a young age.
And a number of the teenagers that smoke now, a huge percentage of them will eventually die from smoking. This is an ideal time to talk about the incidence of smoking in teens. What can you tell us about youth smoking in Virginia?
1 in 3 students have tried smoking. That's 17% of middle school students have tried smoking and 45% of high school students. 10% of them started smoking before the age of 13.
Thank you very much.
13 students smoked in the last 30 days, and an estimated 217,000 students in grades 6 to 12 reported ever having smoked, including 85,000 who smoked in the past month.
Wow.
33,200 youth under age 18 will try cigarettes for the first time, and 152,000 youth will eventually die from smoking. And 336,000 youth are exposed to secondhand smoke at home every day.
Okay, so let's talk about secondhand smoke, because my tease in the beginning, I said, how many of you smoke, but you don't smoke using a cigarette? You just smoke in the presence of people that are smoking cigarettes. What can you tell us about the incidence of secondhand smoke?
According to the results from the 2008 adult tobacco survey, many adults reported being exposed to secondhand smoke, which means in the past 7 days they were around it either inside their homes, in their vehicles, in other people's vehicles, at work, or in other indoor public places. And the same survey found that American adults reported that their children were exposed to secondhand smoke also in the last 7 days.
In the last 7 days?
Mm-hmm.
That's crazy. Now, Joe, when you were first smoking, were you aware, you probably at that particular time there was not a whole lot of discussion about secondhand smoke. When did you become aware of the dangers of secondhand smoke? And how did it impact your smoking habits?
I want to say in the mid-'80s, the commercials were starting to come out about cigarettes and how they came off of TV, because remember, they were on TV. You know, usually sit there and watch gun smoking and cigarette commercial. So then they stopped all that stuff, and you kind of lean forward and say, wait a minute. So as I got older, I saw it on TV, and I saw it cease and desist. But that didn't stop, as it hasn't stopped today, because like you said earlier, the media has glamorized it. In the videos and TV shows now, Boardwalk Empire, I go on and on. Somebody smoking cigarettes.
So they have brought smoking back into
back.
entertainment.
Sad, it's back.
Yeah.
It's chic to smoke, and it isn't.
Yeah, I thought that I had seen a person or two smoking in a movie.
Mm-hmm.
How does that happen? Any thoughts on that?
They actually have some restrictions on it now,
Okay.
with how they rate the television
Oh, really?
show. Yeah.
So
and if there's people smoking, it has a stronger rating.
So if the producer is okay with a stronger rating,
Yes.
wow. So it's kind of like we stepped backwards, because there was a pretty much wholesale prohibition on it at one time. I'm pretty sure it was. What about the benefits of smoking cessation? What can you tell us about that? What happens when someone stops smoking?
When somebody stops smoking, the first 20 minutes, their blood pressure and their pulse rate's going to decrease.
In the first 20 minutes?
First 20
Yeah.
minutes. 12 hours after quitting, your carbon monoxide and oxygen levels in your blood returns back to normal levels. So 24 hours, that's 1 day, your chances of having a heart attack decreases. 2 days, 48 hours, you get a better sense of taste and smell. And 2 weeks to 3 months after quitting, your circulation improves and your lung function increases. 1 to 9 months after quitting, coughing, sinus congestion, fatigue, and shortness of breath decrease. 1 year after quitting, the likelihood of heart attack is cut in half of that of a smoker.
In 1 year?
1 year.
Yeah.
It's hard to get to that year,
Yeah.
but
yeah.
if you can make it to 1 year. 5 years after quitting, your stroke risk is reduced to that of a non-smoker. 5 to 15 years after quitting, your stroke risk is reduced. 10 years after quitting, the lung cancer death rate is about half of that of somebody who's continuing to smoke.
Those are reasons, a lot of reasons, in addition to the benefit of stopping smoking for people that are becoming victimized by your own smokers, secondhand smokers. Now, I have a few more questions, but I want to make absolutely certain that we get talk a little bit about the smoking cessation program that the Virginia Department of Health has, and to get some contact information. Then if we have some time left, we will come back here. The Virginia Department of Health, the TUCHIP, I keep calling it, I want to call it TUCHIP program, the acronym TUCP, the
Yes.
Tobacco Use Control Project. Tell us about the QUIT programs that the VDH has.
Virginia has our Quit Now Virginia Cessation Program, and it's a telephone counseling service, and you can call 24 hours a day, 7 days a week, and receive one-on-one counseling to learn how to quit smoking. You can also receive self-help information, and they will mail you some brochures on how to help quit. And if you have insurance, they will refer you to local cessation services that your insurance will cover.
So that's good. The insurance companies will, in fact, cover some smoking cessation programs.
So who can access this?
Right.
Basically, the number is 1-800-QUIT-NOW,
Okay.
and anyone can call. And as I said before, it's counseling services each day from until 3 a.m. And if you happen to call after 3 a.m., you can leave a message and they'll call you back when they open in the morning. Eligible callers can receive information and self-help materials. They'll be referred to local community services. Callers who are ready to quit within 30 days will receive comprehensive counseling intervention. There's no limit on the number of times that you can call. And there are specialized counseling services provided to pregnant smokers, and our services are available in English or in Spanish. And there is a special phone line for the hearing impaired, which is a TTY line, 1-877-777-6534.
That really seems like a contradiction to me when I see a pregnant woman smoking a cigarette. That one I can't wrap my brain around. Now, again, I want to get to some information on the contact information on the Tobacco Use Control Project. How does someone reach your office?
They can call our office at 804-864-7887, and we are located in Richmond, Virginia at 109 Governor Street on the 9th floor. And you can ask for me, or you can talk to one of our other counselors that are in the area, and you can access our webpage at the VDH site at www.vdh.virginia.gov.
Now, Joe.
Yes, sir.
How have you personally benefited from having stopped smoking? Have you seen changes in your life?
Chelsea referred to earlier, especially the tasting and smelling. You smell, you taste, you lose weight. You gain at first, but you lose weight, and your sense of what you did and how revolting it is to you helps you want to spur somebody else to stop. It's kind of you condemn it, not at the person but the thing, because you know how terrible it is, and you try to help other people not do it. My sons are 22 and 20, and from 5 years old until this day, I told them, don't do it. I don't care what you see on TV, I don't care what you see. This will kill you. There's a big sign on there, and there's a little thing called the internet now.
Right,
you can
right.
type in some letters and you get all the information. So, and it has to be hands-on. Barbershops, hair places, it has to come to folks. TV is great, it's a great medium, but folks, when they see you tell them this and they know you or know of you, it's a different feeling, like what we're doing here. This is beautiful, but face-to-face in people's neighborhoods, that will help a whole lot. But my parents, again, were quite ferocious about making sure to stop smoking. And after I thought about it and got older, I was like, wait a minute, this is crazy, you know. I'm kidding myself. I hate to say it like that, but that's what I was doing. So,
well, you're so well known in the local community. I think that having you on the show to talk about your own experiences will have a positive impact on people that are in fact smoking. And with the information that you've given, Chelsea, I think that folks will be inclined to take a second look. You know, and you pointed out if someone makes it for a year, I know that's a hard thing to do. And it takes several times for someone to try before they're successfully stopped.
Average is about 7.
About 7 times?
7 times before
Really?
they're successful.
You know, I remember you talk about fathers. My father was a smoker, and he smoked. I'm not sure why I remember this, but I think he smoked for like 32 years. And perhaps I remember it because after trying just a couple of times, he just one day said, I'm not going to smoke anymore, you know. And
went to Costa Rica, yeah.
And he stopped, yeah. What was that Costa Rica
Costa
thing?
Rica, yes. When I smoked, I coughed, and I'm like, whoa, and I just coughed and coughed and coughed till I was south of the border. That's what it felt like. So,
And we, of course, at the Health Department are doing a program, the Clear the Air program for our employees, and we're also passing on information about the quit line, the quit now line, and so forth. Would either of you like to add anything at all about our topic today, smoking cessation? Yeah. Well, one thing I will share that, and this was astounding to me, that even today, I share with you that I had the occasion to visit the emergency room recently, but there was a guy in there that he was smoking 5 packs a day. That's a lot of cigarettes.
Huge.
And the reason that I think of it again is because of what you stated earlier, that what is it, 40% of 44% of Virginians, I think it was, that had tried smoking at least once in their life, which meant that they smoked at least 100 cigarettes, and that's 5 packs of cigarettes a day.
Yeah.
Yeah, that's a lot of smoking.
And expensive.
Very expensive. You were saying in New York right now it's $14 a pack.
Here it's about, I think, $6. So
Imagine that a day. Two packs a day. That's what, $12 a day?
that's $30 for him.
Well, this guy that I spoke of, he wasn't buying his Dilantin medication, but he was buying, 5 packs of cigarettes a day. Yeah. One last thing I'd like to ask you: do you think that there is any likelihood that we'll see a smoke-free society? I know that's a very open-ended question.
Yes, it is.
It's wishful thinking.
Yeah.
I would love to see it happen. I would probably be out of a job, but I would love
Yeah.
to see it happen. I think that if we keep going in the direction we're going, that eventually we'll get to it.
And we see the prohibitions in a lot of different places. I want to thank both of you for coming on and joining us today for this special edition of Health Watch, talking about smoking cessation.
Thank you.
All right. And we want to thank you for joining us for this edition of Health Watch. If you want to see previous editions of Health Watch, you can go online to www.norfolk.gov. And please tell a friend about this show. We'd like for you to drop a line to us, and you can drop a line to me and email me directly at terrence.afra-anderson@vdh.virginia.gov. Please feel free to also call me at 757-683-8836. That's 757-683-8836. For the Norfolk Department of Public Health, I'm Terrence Afra-Anderson, and this has been Health Watch.